Okay, I'm so glad that we are all here together. We have been here for 5 meetings, so today actually marks the first one after the halfway point. And I'm really glad that we've had this chance to get to know each other a little bit more and for you to come this far in the journey, because today's talk is a little bit more on the personal side, a little bit more about the emotional side of stroke, which, as you all know, is very important to me. And I feel sad sometimes that we don't focus on it nearly enough in our typical medical setting. So I wanted to take this opportunity to go through with you everything I think about it and all of the absolute musts that I want you to know in your recovery journey. So as we get ready to do rule number 6 today, let's just briefly talk about where we've been. So the first thing we did together was rule number 1. This is make your map. And I really like this rule because no good treatment happens before a good assessment happens. You have to know where you're at, you have to know where you want to go, and that tells you where you are in the map. And the landscape of post-stroke life can be very overwhelming, and without the structure and without the boundaries of where you are and where you're going to go, it concerns me that we can't get clear on our goals. And so what I encourage you to do here is really take stock of all your post-stroke symptoms and get real with yourself about everything that's changed or that has been lost, and that you want to go forward and rebuild, because until you know exactly what it is, you're kind of a little bit fumbling in the dark. Rule number 2 was the importance on building on what is familiar. And this was all about how to personalize your rehab based on the truth that no 2 brains are the same, no 2 strokes are the same, and no 2 stroke recoveries are the same. So if you just take the cookie cutter of what the rehab world has to offer you, I'm afraid you're not going to personalize your rehab enough to get the very best recovery that you can get. Number 3 was all about repetition and consistency, which you now know repetition is the fuel of neuroplasticity and consistency is what keeps it going. So we talked about the really incredible amount of repetitions that people need to really be able to see those changes in brain function. Number 4 was pretty fun. I thought it was all about harnessing your creative power, whether or not you want to be a recipient of art and creativity, better yet, if you want to participate in it. But it's an opportunity to bring some awe and joy and spontaneity and peace into this recovery. And last time we were together, we did rule number 5. This is where I taught you all about the very important truth about sleep, that really what we're trying to do in your recovery is keep you balanced between the very hard work that has to happen, but it can't just be go, go, go. You can't burn the candle at both ends. You have to really respect the need for sleep. And today what we're going to talk about is how to increase your emotional resilience. And really what we're going to focus on today is your mood, how you have been feeling inside in your emotions since the stroke. And of course, we're going to be finishing up in the next few weeks with the remainder of the rules. So what I always like to do before we start on a new rule is to give you a recap on where we have been to date, just to make sure you really distilled all of the pearls that I wanted you to get. So in session 5, I hope that you learned that you must balance the hard work of recovery with long periods of high quality uninterrupted sleep. We focused on the truth that good sleep quantity, good sleep quality enhances your ability to recover because it promotes healing, not just chemically and physically, but emotionally too. We talked about sleep and its major restorative jobs for the brain. And I thought this was pretty startling that statistically more than 70% of you survivors out there, if tested properly, would meet criteria for a sleep disorder that is interrupting your ability to go into those deep healing phases of sleep. And that's really not okay. So I encourage you to consider anything within your control that you could work on. Things like managing different chronic medical conditions better, different types of medication effects, things like poor sleep hygiene, which is when we're not really doing ourselves any favors to get a good night's sleep. And if none of those recommendations worked, I encourage you to please advocate for a sleep study for you or a loved one. And if you remember, I said you're going to have to be a good advocate for that, because very, very few people actually follow through after a stroke with a doctor's recommendation of getting to the point of actually doing a sleep study. Okay, the bottom line for rule number 5 was that sleep is a staple of physical, mental, and brain health. And it's really all about these 5 stages. We talked about that throughout the night, you go in and out of these different stages in sequence, in order. You can't skip around. Oftentimes, we're in a very light stage of sleep in sleep 1, and in stages 2, we're really transitioning to settle down physically, but to kind of gear up neurologically. Once we hit stage 3, we're really starting to get into that deep restorative sleep, but that's a very short period. If you look at my graph here, that's only 4 to 6%. Stage 4 and 5 is where I need you to get multiple times per night, because that's where the brain healing is happening. What we talked about in depth last time was obstructive sleep apnea, when you stop breathing, either because of something that happens in your respiratory system, something that happens within your throat, sometimes even your tongue moving to the back of your mouth. And during deep sleep, you get jerked out of sleep because you stop breathing, and an alarm bell goes off in your brain, which sends a lot of stress hormones coursing through your veins. But also, when you finally fall back asleep, you're not going to start again in stage 4. You're going to have to go to the back of the line at stage 1. And so it's critically important that if you snore, if someone tells you you are stopping breathing in the middle of the night, by all means, please get a sleep study. Untreated sleep problems will reduce your ability to recover from stroke, and it's mostly because of this. Brain repair mechanisms are activated during deep sleep that are breaking down all of the stroke remnants, all the damaged areas that we don't want in there anymore, any blood, any little bits of brain cells that were unfortunately damaged or lost. And we need to clear out the junk. It's like getting rid of the leaves in the fall, because we want good soil to go down for the new seeds that we're trying to plant. And how you're planting new seeds is by doing all that hard work of rehab. So you plant a seed in the soil, but if the soil isn't ready to take the seed, not going to be successful, right? So I really want you to think about that metaphor as you consider how to prioritize your sleep. So let's talk tonight about Rule 6. This one is really, really important, because not a lot of attention gets paid to the emotional experience, the subjective experience of stroke. And it's a whole other world. Just like we can have our outer world in reality, and that's what gets focused on so much, you know, our physical issues, our strength, our vision, all that stuff, of course, is incredibly important. But my philosophy is that you are a human being first, and you have had a stroke, right? Not that you are a stroke and that the only thing we should care about is the physical part of your being. So I want to talk tonight about the importance of trying to foster, as often as you can, a positive and motivated attitude, because it really makes a difference in your recovery. So stroke journeys, in my mind, stroke recoveries are emotional journeys, and they don't happen in the same way for everyone. And in fact, even the stages that we know are very common don't necessarily happen in the same order for each person. And sometimes we go through one stage and we backslide a little bit to another. But what I want you to think about is kind of the broad journey. And in general, if you're going in the right direction, then that's great. What I'm worried about is if you are stuck in anxiety or negativity or depression or hopelessness, irritability, or worse yet, you actually feel like you're slipping and you're kind of gasping for air just above the waves. So for most human beings who live through a stroke, there is a sense of shock and numbness that often happens many times in the ambulance, in the emergency room, in the hospital stay, followed by a sense of denial, kind of like, I can't process this. I cannot really fathom that this has happened. Oftentimes, it's very normal for people to get angry after this phase, okay? Especially for folks for whom the stroke was incredibly unexpected. You know, many people feel like, damn, I played by the rules. I did the exercises. I ate right. You know, how are we here today? Sometimes anger at ourselves. You know, I was told to stop smoking. I was told to exercise more, and look, here I am. Bargaining is a very natural part of the grief process, the shock process. And, you know, that's kind of a praying, type kind of pleading feeling to the world, like, let me live through this, let me come out of this without major disability, and I promise I'll be better. And then after we go through those initial phases, we oftentimes see a sense of depression. And what is really depression? What we talk about in mental health is that anxiety is a grief and a sadness and a worry that's focused in the future, all of the what ifs. A lot of times we really feel like depression is focused on the past, and either a regret or a guilt from the past, or more of a yearning for the past. God, why wasn't I more appreciative for things? Or, just really not being able to see beyond today, not really being able to imagine that things could change and you could improve and that things can get better, but just really having a sense of hopelessness. And in fact, post-stroke depression is a big focus for us today because it's the most common thing that folks go through after a stroke. And if we don't acknowledge it and you stay stuck in it, it could really, really bring down your recovery. Very slowly over time, people can often reach a certain sense of acceptance. And that is actually the final stage for us, rule number 10. And it's important because I want to give you instruction on how to do that. All too often, people don't understand what acceptance really means. They're afraid it means some other things. And it is something that requires skill building and support. It's not as easy as like, things have changed and you just have to get over it. That's not how we work as human beings. We need to be told what to do, and we need to be supported to get there. And ultimately, the end point of any traumatic journey is finding the meaning, not the reason why it happened, or, you had some lesson to learn, but more, what are you going to take from it? And how is it that you can continue to live a life that's aligned with your values and the things that are most important to you? Again, when we get into rule 10, we're going to really break that down in a lot of detail. And the final frontier in any recovery journey is using your experience to lighten the load of someone else in your same shoes, applying what you've learned to other people's recovery. The things that I'm most impressed with in today's stroke recovery care programs is when they do peer-to-peer support. Nothing in my mind can replace that. Someone else who's been in that journey, someone else who literally has walked the walk. Doctors and nurses and therapists, we have a very important role, but it's very important that everyone acknowledges that we haven't been there yet. We haven't lived through that experience. And so I feel really strongly that we need to get people who've had similar strokes together, similar severities, who can relate to each other, right? Peer to peer. So just like the physical recovery doesn't really ever end in stroke, I really feel too that the emotional journey doesn't really end. A stroke, is a very significant change that was just kind of dropped in your lap. And I think it would be a bit naive to feel like we can wrap up an emotional recovery in a tiny little bow and not think that you're not going to be fundamentally changed, right? But what we have to talk about is how can we help people on some emotional level feel that they are still themselves, or in fact, talk about something called post-traumatic growth, which is some people actually feel that they were better for having gone through their emotional trauma. Emotional health really matters. It matters a whole lot in your recovery. It's really important that you believe that this recovery journey is not just about your brain. It's not just about your arm. It's not just about, speaking or aphasia. It's really about healing yourself. The brain is right there next to you, but I don't want us to just ever focus on brain, right? Person has to be the first thing. Our ability to have emotional strength after a stroke has a major influence on recovery. Identifying and treating common mood symptoms like post-stroke depression have to be a priority. So as we're going through today's rule, this can apply to you to a little extent. You might think, you know what, I feel like I have really come to terms with what's happened, and I'm able to, still feel pretty at home in my own body and in my own self. That's awesome. I think the vast majority of people are a little bit more in the middle, where they really struggle with mood and maintaining hope and positivity. And then we have some of our friends who can be in very, very dark places. And so what I want to try to do today is reach everyone, okay? Post-stroke depression is the main factor limiting recovery after a stroke and leads to greater disability and reduced quality of life. So let's just kind of slowly repeat that, okay? Post-stroke depression is the main limiting factor in recovery, not a major factor, but literally the most influential factor on your long-term recovery is your mood. Okay, so let's demystify what post-stroke depression looks like, because I can tell you as a psychologist, people have a lot of ideas about what depression is that actually aren't depression. Okay, when you are depressed, it's more than just feeling sad every once in a while. Okay, and this is an actual diagnosis that we give in mental health, and it requires having a depressed mood, which interestingly does mean different things for different people, but in general, you know, not at peace, not happy, not positive, not optimistic, you know, dark, hopeless, not feeling like they have the energy to go on, you know, very much a change from where they were before, or a sense of not caring, you know, just like, I just can't process this. I can't deal. I'm not doing my therapy exercises anymore. You know, basically I give up. And this has to happen for more than 2 weeks. So that plus any one of these four, okay? So a change in appetite, a change in weight. Those are interesting symptoms because they really go in either direction depending on the person. And all of us, you know, have been highly stressed or a little depressed at certain points in our life. And you can think, you know, when you're stressed, are you going to go to food for comfort, or does food turn you off? You know, are you going to want to crawl in the bed, or are you so agitated that you can't imagine giving in to the restful posture and the mindset that you would need to actually fall asleep? Agitation, not feeling comfortable in your own skin, feeling like you could just, you know, crawl out of yourself if you could, feeling like you can't sit down. This can also be mental. We can have racing thoughts, you know, really that sense of kind of being overwhelmed where the thoughts can overtake us. The next symptom is feelings of worthlessness or guilt. This is really something that I see in our stroke community. You know, we get so much of our identity as Westerners, you know, maybe even more Americans, by what we do. You know, our function in society becomes our identity. And so if we can't go back to doing that, there's a sense of having no identity, or not being able to contribute, you know, all the way to maybe not being able to drive. There's just this, you know, we equate those functions, those abilities with self, right? So driving means independence. When we can't do that, there's this feeling of kind of being a non-person. And the truth is, if we're all honest with ourselves, you know, being someone with a disability in this world is extremely, extremely hard. People oftentimes don't get it. Sometimes it can feel like people don't want to get it. You can get looked at when you're out in the world. People can talk over you. People don't slow down to include you. It really stinks. You know, there's no two ways around it for many people. Difficulty concentrating or making decisions, thoughts of dying, feeling like you might have been better off if you would have actually died from the stroke. And these symptoms have to be severe enough to interfere with some major aspect of one's life or one's function. So the way I see this mostly in post-stroke depression is in things like social functioning. So saying no to invitations, not really wanting to be in a crowd. Or we can see this in occupational functioning, in that, you know, we're so overwhelmed, or we don't have the mental energy to care, that we just can't do the things that we used to like to do, maybe like read when you actually can read, when your vision is good and you're, you know, you have the cognitive ability to read, not being able to perform in a way that you would like to and that you're capable of because you're just so down. Symptoms of depression are super individual. If you were to look at me during times of depression in my life, it would look very different from you in times of depression in your life, okay? There's no one way to be depressed. This is a big stereotype that I see often, that you have to be suicidal to be depressed. Totally not true. You can't always tell by looking at someone if they are depressed. Boy, is that true. And that goes both ways. People who are depressed don't necessarily look it. And there's people that look really depressed, but actually aren't. And that, in fact, is one that we see more often in our stroke community. We're going to talk about that in a minute. Sometimes even us ourselves don't recognize that we are depressed. Sometimes it takes a loved one, a trusted person in our world, to point out to us that we aren't showing the same amount of interest or enthusiasm, or we're very closed in, or we can't seem to sit still, we can't seem to relax, that we just have a very blah kind of an attitude. And in fact, this can happen as a consequence of stroke. One of the neurological things that can happen is that people can lose or have a reduction in their ability to have insight or awareness into their own behavior. But in general, remember I was saying before, the symptoms can be so different, but if you were to do a research project on folks with depression, basically they would tell you that they feel a sense of numbness, which often comes from being overwhelmed, emotionally drained, and hopeless. And probably why post-stroke depression is so high is because of that duality between mind and body. When the body is exhausted, the mind very, very much follows, and vice versa. When we have neurofatigue, think about how we feel. It's so physically draining, right? And it's because we're not just mind and we're not body, of course, right? We're two sides of that same coin. So if we start to look at the statistics on post-stroke depression, what we see is that between 18 and 55% of you, if properly evaluated, would meet criteria. That's a lot, you guys. But again, just like my sleep apnea statistics, look at the number I have here for how many who were actually diagnosed and treated. Only 5%. This is absolutely unacceptable, because it means that a lot of people out there with stroke aren't getting, aren't getting as good as they could get, not getting as healed as they could get, because someone is not recognizing or treating symptoms of depression. So our power and control is to talk about it here and to push all of you to getting an evaluation or treatment if you need it. The research tells us that post-stroke depression is the highest in the first year, which makes sense. That's when the most intense adaptation has to happen. It is highest in stroke survivors who don't have good social support, have higher disability, and have lower independence because of stroke-related deficits, which I think makes total sense. And it's hypothesized that the social support has a lot of impact here. And mostly this is because even if we have one person in our corner that we can count on, that really protects us a lot emotionally. Those are the people that cheerlead us. They're the ones that motivate us to do the rehab. They're the ones that can help us, make sure we're eating properly. So sometimes, it can feel, and I think it's probably true, that things change very much socially for people after a stroke. But remember, what the research really tells us is it really just takes one. When you have one person who is there to give you that cushion of social support, those are the people that do better. Now, here's where it starts to get a little bit tricky. And again, this is where the individual assessment is very, very important, like seeing a neuropsychologist, because there is a lot of overlap between the symptoms of post-stroke depression and symptoms of stroke. So let's try to tease that apart a little bit ourselves. Okay. So many times after a stroke, let's just take some of those symptoms of depression I talked to you about before and figure out how they overlap. So let's just take loss of appetite. Well, trouble swallowing is a very common symptom after stroke. It's kind of fascinating just how much coordination between breath and muscles, many groups of muscles, have to come together in a perfectly coordinated way to help us do something like swallow, okay? And so many people struggle with swallowing after a stroke. Well, if you can't swallow properly and eating and drinking is painful, or you choke, or it's laborious, or you lose the habit of doing it because you have an IV and you have a peg tube for eating, there's very normally going to be a loss of appetite, right? So that one gets a little tricky because now we've got that overlap. Fatigue, yes, we see fatigue in people with depression. It's a huge symptom. Depression absolutely zaps people of their physical energy most times. Well, we all know about neurofatigue, right? So now we've got those two things. Things like trouble concentrating absolutely happen after stroke, many different types of stroke, because concentration is really the second cousin to attention. And I have taught you guys before that attention requires a lot of different parts in the brain working together and communicating. So no matter where you've had your stroke, a piece of the brain is going to be offline afterwards, right? And so that just means that instead of being able to immediately make a connection and have instant retrieval and find that word quickly, it's just going to be a little bit slower, okay? So we see that in depression too. People who are very depressed talk slower. They're like walking through mud, okay? And sleep disturbance, incredibly common after stroke and incredibly common in depression. So how do we handle that? Well, I can tell you broadly what I do as a neuropsychologist, and you can have your own doc look at you. You can ask yourself these questions. As a caregiver, you can try to think through this. What we really try to do is tease apart physical and non-physical symptoms. And what we really need to do is ask, to the degree possible, the person with a stroke to answer some questions for us, okay? And what we're trying to get at with our questions is mood separate from a function. So what I mean by this is guilt. Guilt is very common in depression and in stroke, but when it's really prominent, it's typically telling us that real depression is there in addition to the stroke. Things like just feeling hopeless, things like feeling worthless, okay? Those aren't necessarily just related to the stroke. Oftentimes there's telling us that we have an additional weight on top of the recovery, which is post-stroke depression. Now, I'm not saying if those symptoms are there at all, that the person is automatically depressed, okay? What I'm saying is if they are persistent over 2 weeks, or if they're so significant that the person is almost like Velcroed to those feelings, right? And they just really don't change their mindset. It reduces their ability to want to do exercises and therapies and, resume life, that it's so significant that it really weighs the person down, okay? The other thing that's really important that we tease apart is the difference between post-stroke depression and post-stroke apathy. So I wanted to spend a little bit of time talking about that. So remember I said before, in stroke, what often happens is that folks with stroke can look depressed, but they're actually not. So a lot of times people who have apathy, post-stroke apathy, get mistaken for being depressed, okay? Apathy is a behavior syndrome after stroke or different types of brain injury. And about 40% of stroke survivors can have this syndrome, and it's not depression, although it kind of looks like it. It's characterized by low motivation, don't want to do it, don't care to do it, don't care if it's going to help me, and flat emotions, never really too low, never really too high, just kind of almost like a detached kind of a feeling, not really showing interest or responding to things in kind of a vibrant, quote, normal way. Oftentimes folks who have post-stroke apathy post-stroke apathy, either have had significant damage to one of their two frontal lobes, either directly or, as we've talked about, different parts of the brain are connected on circuits, and sometimes we see indirect damage. Even though the frontal lobes might not be injured, depending on where they've had the stroke, there's these connections and it can take the frontal lobes to some degree offline. The worst we see with post-stroke apathy is when someone has what we call bilateral damage. And what this means is the same part of the brain is damaged on both sides. So both the left hemisphere and the right hemisphere have damage in the same structure. So left frontal lobe, right frontal lobe, left basal ganglia, right basal ganglia, left cerebellum, right cerebellum. When it's dual and it's on both sides, it's very, very hard to compensate for that. People with post-stroke apathy, when you start to ask them about their mood, they don't really have reports of feeling sad. They're almost feeling a little bit, I don't want to say numb or detached, but they're just not very emotional. It's kind of right down the middle. Typically don't report feelings of guilt or worthlessness, and typically don't talk about wanting to die or wishing that they had died. Research tells us that post-stroke apathy and post-stroke depression are two totally different things. They happen for different reasons, and they respond to different treatments. So a big part of today's talk is, if you identify as being depressed, perhaps, I want to help you understand what you can do about it. And that's really the focus of the rest of our time together today. That doesn't really apply to post-stroke apathy because it's not depression, right? So what works there? Well, interestingly, what the research tells us really works is more stroke rehab. Guess what? These are the people that get told they're not making enough progress, or these are the people who don't qualify to go to intensive rehab because they can't do 3 hours of rehab a day. That is one of the things that makes me mad and breaks my heart, is when more rehab would actually help, but we don't meet the system's criteria to get someone into a program. That is totally inhumane in my book. The other thing is stimulant medications. We talked about this a little bit with neurofatigue. These are the kind of medications that are sometimes given to people with attention disorders, things like multiple sclerosis, and stroke, where if there's just kind of a sense that the system is running a little bit too low and we need to increase alertness, stimulants can be very helpful, but you need to be personally evaluated to make sure that they are safe and appropriate for you or your loved one. So I wanted to present you guys with a questionnaire where we could try to really make this information personal. If you were here for my introduction to this stroke recovery group, what I talked about is I have a challenge in making this the best experience for you, because on one hand, there are some universal truths and, these 10 rules of rehab that will help everyone. But the truth is, brain health has to be personalized. And so I wanted to talk broadly about post-stroke depression, but I really want you to take stock of you or your loved one right now and come to a determination on what you think might be going on. So this is the Patient Health Questionnaire 9. If you have gone back for a follow-up evaluation, sometimes even at primary care, this is a very common questionnaire because it's what they call quick and dirty. They can do it, a nurse can do it in just a few minutes, and we get a quick cutoff score, and we can decide if we need to talk about mood or if we just get to go on with the evaluation. So let's take a few minutes here and go through these. You can grab a pen if you want to. You can count on your fingers. You can, call it off to a loved one. I want you to think about the last 2 weeks, including today, and let's go through these questions, and I want you to rate yourself from not at all, which would be a 0, to several days of the last 2 weeks, which would be a 1, more than half the days of the last 2 weeks, which would be a 2, or nearly every day of your last 2 weeks, which would be a 3. Okay, so in the last 2 weeks, how have you rated in terms of little interest or getting pleasure in doing things? Are you a 0, a 1, 2, or a 3? Next question is, in the last 2 weeks, how often have you felt down, depressed, or hopeless? In the last 2 weeks, have you had trouble falling, staying asleep, or sleeping too much? In the last 2 weeks, have you been feeling tired or having little energy? 0 to 3. Poor appetite or overeating? 0 to 3. Feeling bad about yourself, that you failed or have let you or your family down? 0, 1, 2, or 3. In the last 2 weeks, have you been having trouble concentrating on things like reading the newspaper or watching television? In the last 2 weeks, have you noticed that you've been moving or speaking slowly that other people have noticed, or been so fidgety or restless that you've been moving around a lot more? And number 9, in the last 2 weeks, have you had any thoughts that you would be better off dead or hurting yourself in some way? Now, of course, as you smart people have already picked up on, I'm sure, this is not a stroke specific questionnaire. How many of these things could you say yes to just because of stroke, right? Let's see, number 8 comes to mind, you know, speaking so slowly. If you have dysarthria or aphasia, you're gonna say yes nearly every day. So try to answer these questions just in terms of the mood stuff, okay? So this is not stroke specific, but my cutoff score is. So there's good research to say that if you got a 6 or above on these questions, right, that you are more likely than not having post-stroke depression. So you can watch this again when we send you the replay if you need a little more time to go through it. But if you're over 6, I really want you to take that serious. And here is why. If you got over 6 and you have post-stroke depression and you don't treat it, this is the risk. You're going to have more pronounced cognitive deficits. What I mean by that is your memory is going to be worse. Your ability to focus is going to be worse. Your decision making, your problem solving, your multitasking, worse, worse, worse. You're going to have more long-term disability if you don't treat your mood, okay? More long-term disability means less independence and less ability to do things in life, less function. You're going to have a lower quality of life if you stay depressed, okay? And you're actually more likely to die. So I don't know how I could make it more serious. I don't know how I can help you understand what more is on the line here, okay? So that's all compared to people who've had strokes that aren't depressed. So what do we do about it, okay? Well, there's a gold standard. The best results happen with a combination of approaches, which can be a combination of pharmacological, which simply means medication, psychosocial, which means things like therapy and couples therapy and family therapy, and more stroke rehab. Isn't that interesting that more help, more support, more treatment not only does a body good, not only does a brain good, but does a spirit good, does a person good. One of the things I love research-wise is that education on how to prevent another stroke in and of itself has been shown to reduce post-stroke depression. And I think that really speaks to how many people have anxiety about having another stroke and how that can really preoccupy them, kind of can take you out of the game in terms of your ability to focus on the here and now. And you know, for many people who are depressed, they would report to you, it's like, I'm not a part of things anymore. I'm a couple steps behind people. I'm not a part of the gang anymore, okay? And so if we're very preoccupied with anxiety, that's gonna happen. So that's kind of the gold standard, okay? And I'm gonna teach you how to do some of that stuff. But what I'm gonna focus on now is the things that are really within your control, kind of starting points. Where can you go from talking with me today into the future and really try to make your way in a more positive journey. So this is where we talk about increasing your emotional strength and your resilience. And you do this through monitoring and improving your thoughts and actions, okay? I promise this will all make sense soon. So emotional resilience, it's a little bit of a mouthful, but basically I want you to think about it like this. Emotional resilience is a way of coping after a major stressor, no matter what it is, a divorce, a bankruptcy, a heart attack, a car accident, a stroke, that allows some people to not have their spirit broken and continue living a life of quality despite new challenges and limitations, okay? Rather than letting a stressor, a trauma, this stroke overcome you, emotional strength lets you believe that you will find a way to rise and go on to live a fulfilling life of meaning. And this isn't to downplay or invalidate or not tell you that I don't think that this is incredibly hard and that this may be the challenge of your lifetime, but with the right supports, with the right skills, it really is possible to grow in your emotional strength now and really come out on the other side of this, feeling, believe it or not, better, stronger, more connected, and reaching your potential as a human being more. So what are the ingredients of resilience? I just think it's so helpful to break things down just to really, really help us grasp these concepts. So when we feel emotionally strong, we typically feel all of these different ways. So the first one, and this is really important if you're starting your journey of trying to get out of any kind of a hole emotionally you found yourself in from the stroke. The very first thing, you can't move forward without this, is feeling safe and secure. This is the bottom line. And that is really hard if you owe, you know, 30 grand, to the local hospital. You're not going to feel financially secure. This is really hard if your housing is unstable. But this is also really hard, again, if you are really petrified of having another stroke, or feeling like you don't know how you're going to meet ends meet. And so this really gets back to one of my favorite psychological concepts, which is Maslow's hierarchy of needs, which is a very, very true psychological metaphor that helps us understand that as human beings, we have some very basic needs, and we can't reach higher for like self-actualization or even mood if we don't have the basics. And safety and security is the most basic human need. So we're going to talk about later today, if you don't have that, how to try to get that. The next one is just kind of a general view of being optimistic, not feeling like you have that rain cloud following you everywhere, right? Just a sense of really just seeing life how it is, that yes, unexpected things can happen, and tragedies can strike people without warning. That's absolutely true. But it's also true that unexpected, beautiful surprises can happen, and unexpected things that enhance your life and actually help you go deeper and more positive with this human experience. Regularly feeling that you have positive emotions. Go back to your feeling wheel that we gave you guys recently, and look on there and look around. These 4 emotions are research proven to support people in their stroke journey, and they are joy, gratitude, serenity, and love. So however you get to that place, however you feel a moment of joy, music does that for a lot of us. Serenity, for many of us, prayer is how we get there. For others of us, we get there through connecting and bonding with family and friends. We get there through, hearing beautiful words spoken to us, meditating, right? Those things are very important for getting all of those feel-good chemicals going and really soothing our spirit. This is one of my favorite ones, compassion for ourselves, how we judge, how we are coping with the stroke recovery, how we judge our emotional strength and how we have shown up or not for this stroke recovery really has a lot to do with how emotionally strong we feel. So, I want you to be kind to yourself when you think about all that you've been through. I know that I'm extremely proud of all of you who have gone through an unexpected brain health challenge. Next one that's research proven is sense of humor. Whenever the mood strikes you and something seems absurd or funny or, hilarious, it's one of the most releasing things that we can do as a human being. Next one is to be in at least one validating relationship. So what do I mean by a validating relationship? That means someone who doesn't minimize your struggles. That means somebody who pays attention to how you're acting and how you feel. Someone who lets you know that they see how hard you're fighting and how far you're coming, and is kind of walking the journey side by side with you, not in front of you and not behind you, kind of right there. Finding the meaning in your life after a stroke. We're going to talk a lot about this. Living your values, that's one of the most helpful things that we do in psychology and therapy, is to get people to identify, what is most important to you? What is this life all about to you? And typically people say, my family is the most important, or being kind, being generous. And knowing what's most important to you and figuring out how to live in accordance with those values or those morals, despite physical or cognitive or sensory deficits, is very, very important part of this emotional journey. Reaching out for help when you need it. This is a difficult thing for many people, especially some of us just kind of have a real independent, some may call it stubborn streak, and that's a real lesson in emotional strength. And the last 2 are all about that golden word of acceptance, which is rule number 10, accepting support when you need it, and accepting yourself as you are now. All journeys in and of themselves. And what's so beautiful about emotional strength is it's not something you're born with. It's not something that once you're a certain age you can't do. It is really a trait or series of traits that you can develop at any time if you have the right guide. And like developing any new skill, increasing your emotional resilience takes time and intention. And intention is so important because intention is a commitment. You know, and intention is I plan to do this. And it doesn't mean you do it perfectly. We set intentions all the time: eat better, you know, call my sister more, you know, exercise more, do my therapies more. We don't really need perfection in this recovery. We just need trying more often than not and staying mindful of your intention. So when we first met in the stroke recovery group, I encouraged you to get real with yourself about your why. What is your why? Why are you with me during this group? Why do you want to get better? Why do you want to keep working hard? And that's an intention. So just like you've set some physical goals for yourself, I really want you to take this rule today and think about how you can set some emotional goals for yourself too. So what we're going to talk about now are 7 ways to increase your emotional resilience for a better recovery. And I just want to say before we get into this part, that I love all of these strategies. These are things that, honest to God, we should be teaching people these things in school. There should be a human school. I've thought that for a long time. You know, people grow up in families of varying degrees of health. Mental health is what I'm talking about. And not all of us are given instruction on how to be emotionally healthy. And so these are things that anybody, stroke, no stroke, caregiver, person, therapist, these are things we should all know and practice. But especially when you have been handed, you know, maybe some sour grapes with this stroke, car accident, you know, loss of someone you love. These are all things that all humans can benefit from. So we're going to go through these one by one. The first one, you got your feelings wheel. Okay, maybe I misspoke before when I said we had already given you your feelings wheel, but I think we have. Yeah, I'm reminding you of your feelings wheel, I think. Okay, so the feelings wheel is awesome. This is our most downloaded PDF that we offer on the I Care for Your Brain website. If you haven't gotten it so far, go on there. We'll get you a free copy. Or even better yet, when you get your handout email for this week, we'll probably, I think we're going to have it in there. Carrie could tell me for sure. And what the point of the feelings wheel is emotional identification. What is going on with me? Look around the feelings wheel. Okay, well, first I thought I was mad, okay, which is a core emotion. But then if you start to actually go out from that, we start to get more nuanced descriptions of that emotion. So maybe it's not really that you're mad, but maybe the truth is that you are hostile, right? You're pissed off about something, and here's the reason why. If we don't identify what the emotion is, then here's the big problem. We can't share it with anyone. We can't express it because it's all just a big static field that isn't clear. And so I really want you to strive to name the emotions that you're feeling. The more you feel these emotions and know what they are, the more you can make sense of them, and the more you can actively go towards those positive emotions, right? So remember, we talked about joy, serenity, love, and what was my other one? I'm going to go back. Gratitude. Oh, of course, gratitude. We're going to talk about that today. Sharing these feelings with a trusted person is a very important first start to getting more emotionally strong, okay? So you're going to tape this up to your refrigerator and you're going to start to use it in everyday life and put more specific words to your actual emotional experiences. Remember before I said how you think about a traumatic event or a stressor really matters? Here's what I mean. This has to do with our self-talk. And so whenever we are challenged by something, whenever anything in life requires something of us, requires our resources, whether it is money, emotional energy, you know, physical energy, our brain does a very rapid evaluation on if we can meet that challenge or not. And when we decide that we can't really handle the challenge, that we don't have what it takes, that's when despair sets in, okay, and a feeling of hopelessness. If you start to train yourself to have more positive thoughts, your brain will interpret yourself as having the resources to find a way. So this is a mantra I want you to say to yourself, okay? This stroke, this recovery is a challenge that I can manage, okay? I have the resources between myself and my circle to meet this challenge, okay? This is very important. How you think about this stroke and your recovery really, really matters. So let's put that into, make it a little bit more concrete, okay? So as you are monitoring your thoughts and watching for any hopeless or pessimistic or negative blanket statements, I want you to try to replace that self-talk with some of these phrases, okay? So this isn't invalidating that you're sad or you're mad or you're scared. You're just trying to put a more healthy twist on it, okay? So you might say something like this: I'm scared, but I can handle what's happening and I will learn from this. This is going to make me stronger. I have people around me who are going to be here no matter what. I've made it this far and I'm going to keep going. My recovery is tough, but I am tougher. And this next one I got from a t-shirt of a survivor that said, nice try, stroke, but I'm still here. So sometimes if we don't check our attitudes, they can really drag us down, take us under, and we do not want that to happen to you. When a stressful thing comes up for you, I want you to figure out what is within your control and what is not within your control. And when it's within your control, you're going to respond with action, okay? Not just thinking about it, stewing it over, letting it bug you. You're actually going to take an action step, okay? So here's a great question. What is within your control? Well, again, these are things that I wish we would teach all people, but there really are things within your control in this life and things that are not within your control in this life. And look at this. Guess which list is longer? So let's talk about what is within your control, okay? What is within your control? I'm not saying 100% of control, but more in control than not for most of us, is our mindset, okay? It is our work ethic. How hard do we try, okay? Even if it is that our abilities and our functions are very, very, very impaired, almost all stroke survivors have some degree of being able to respond. And you can see even, you know, I'm thinking of our friends with locked-in syndrome, even folks who can just move their eye muscles to have yes/no responses or to play, you know, video games that they control with their eyes. I often hear that these people are on those video games hours and hours and hours a day. There's really not enough technology and advances that have happened to probably fully stimulate them, right? Because, you know, there's not many out there. And so even when your abilities are super reduced because of a stroke, we still have a lot of control over the intentions that we bring to the recovery game. How we treat others, oftentimes very much within our control. Okay, what we eat, okay, how we breathe, right? Shallow breathing versus deep breathing. Again, not for everyone after a stroke. I recognize that some people don't have control over these things, but speaking broadly, our self-talk, right? How kindly or, you know, meanly we speak to ourselves. How much love you give in this life, how much love you give today, you have control over that. How kind you are, how gentle you are, how understanding you are, how respectful you are. And most importantly, you have control over right now, what you choose to do in this moment. What is not within your control is anything that happened in the past. Spending time regretting, spending time mad about things that have happened in the past, you have no control over that anymore. The next one is the future. You really, in terms of this moment right here, right now, there's some things you can control about the future, but there's many variables that you can't, that don't involve you at all. You cannot control other people's feelings, other people's happiness, making other people understand what your life is like now, what you have to live with every day. You can be a good communicator, but you can't really make them understand it if they're not interested or they're not willing or they're not capable. So once you've figured out, is it within my control, is it not, then you can think about, well, okay, what can I do that would make a difference? Or how can I think about this different? And those are our two types of control. So we have primary control, which is the what can I do that will make a difference. This is when you actually have the ability to take a reasonable step to change a difficult situation. So the key there is realistic. You're not a superhero. What can you literally do today, right now? Call that person and say, it's hard for me because sometimes I'm not sure you get, how difficult it is for me to have stamina. I can go to the party, but I know you were disappointed when I couldn't stay more than an hour, but that's where I'm at right now, right? That's a reasonable action that you can take to assertively communicate with someone else. If you've done that and they still don't get it, then we move on to secondary control. How can I think about this different? This is your ability to change how you think about a given situation, right? So when you're unable to change it, secondary control helps you find the most positive way to think about it. And both types of control actually give us very similar levels of relief and take away our preoccupation with wishing that things were different, okay? So I want you to spend some time really thinking about this. And it is really important that you keep in mind how you respond to this stroke is at least in part under your control, and that you can choose to some extent how difficult or painful this journey is going to be. And again, I really don't want you to hear me as kind of speaking from a non-survivor perspective and kind of invalidating you or overemphasizing how easy this is, because that's really not my intention at all. But I want you to live within your power, okay? So when you wake up every day, we have a choice, right? What door are we gonna go through today, right? And sometimes we are drawn towards the light door and we can hold that optimism and positivity. And some days aren't like that. And we can be, self-pitiful, we can feel sad. It's not a problem to have a degree of emotion, dark and light, negative and positive. But what we just want to make sure is that day after day, you're not continuing to open up that most painful door, okay? Let's talk a little bit about positive and negative coping. We are all coping all day, every day, or else we wouldn't be here. People who can't cope, unfortunately, really have a hard time living because we are required to cope so many times throughout the day. And what I want you to understand is the difference between positive and negative coping, because a lot of times our brain, our spirit plays tricks on us and we are drawn to negative coping because it is a little easier on the front end, but it always backfires and makes us feel worse in the big picture. So what I want us to do is take two similar scenarios and go through a positive coping reaction or a negative coping reaction. Okay, so let's say for the first one here that we are mad because at a dinner with family, we felt that people were ignoring us and carrying on the conversation and leaving us behind. Okay, so normal feeling, right? Don't judge yourself for the feeling. That's fine to feel that way. But how are you going to cope? How are you going to respond? Well, positive coping would be to give very specific names to your feelings. I'm feeling excluded. I'm feeling left out. I'm feeling ignored. Okay. Negative coping would be to not acknowledge that you're upset, and people see you withdraw. They see you, suck your teeth a little bit. They see you, mad, and they ask you and you deny that you're upset. No, I'm fine. No, don't worry about it, right? In the moment, we get to avoid the conflict. We don't have to be emotional. We don't have to own up to our sadness, our anger, but the emotion is there, right? So it hurts relationships, hurts you when you don't acknowledge what your feelings are. Okay. Similarly, next one, expressing your feelings using assertive communication. We've talked about that a little bit. Assertive communication is where you give yourself as much respect as you give the other person. It's not holding it all in. Negative coping is stuffing your feelings, right? Being very passive, not ever making a peep that you're bothered. And aggressive communication is going, full bonkers on somebody because, they've rubbed you the wrong way. Assertive communication is choosing respectful, calm words to say, this is how it's making me feel, and checking in with someone else. You know, maybe you didn't mean it that way. Maybe you're not aware of how it's making me feel, but this is my truth. This is how I feel, okay? Next one is those positive self-talk, the coaching statements. So I really want you to attune yourself to this in the next week before we meet again. What's going on inside your head? You know, are you your own friend? Are you speaking to yourself kindly, or are you being a bully to yourself? Okay, positive coaching is like, come on, you got this, you know, get up, let's try again, you know, good try, wow, look at the progress you're making, right? Negative self-talk is, you know, you should be doing more, you're lazy, you're not getting any better, you're not changing, right? Be a good friend to yourself and to your own mind, okay? And you can go through these. These are going to be in your handout. These are in the stroke recovery guide. You can rewatch these a little bit later and go through some of these. But really, at the end of the day, negative coping is about avoidance. It's about shoving your head in the sand like an ostrich and pretending things aren't bad. But you know what? What happens over time? You're going to blow. You're going to blow up, and then you're going to hurt relationships, and you're going to flip out over something that's not important, and the person's going to be confused, and then they don't take responsibility to change what's bugging you because you know, you're yelling at them because they ate all the yellow M&Ms, and really the truth is you feel like they've been you know, pushing you too hard. And so it just, everything gets mucked up when we start engaging in negative coping. So really take that serious, okay? The next one, and this is something we're going to send you in your handout, is a gratitude journal. Okay, any Oprah fans out there? I love Oprah. She is my hero. In my business, Carrie will tell you, my goal is to be the Oprah of bosses, because I love the way that she treats people, and I just love her so much. I think she's great. So she's really the one that brought gratitude journals to the American public. And she started writing down 3 things every day that she was grateful for. You don't have to write it down. You can speak it. You can think it. You can ask someone if they're unable to speak in their own mind. You can say, I want you to think about 3 things you're grateful for, and make it a ritual. You want to do this every single day. This has scientific support for increasing emotional resilience. Okay, so remember, good enough for Oprah, good enough for you. The next thing we're going to talk about is therapy. I love therapy. I am a neuropsychologist, and I get the privilege of doing some therapy, but in my next life, I will just be a therapist because I love it. It's such a privilege to get to sit with people in a safe space and to explore their emotional worlds and struggles and to try to help them feel better. It's really something I want you to consider as a way to help you in your adjustment after stroke, especially if you checked off, got more than a 6 on that PHQ-9, that might suggest you're living with some post-stroke depression. So 2 years ago, 2018, a group of researchers put together 23 studies and did what they call a meta-analysis to look at something called cognitive behavioral therapy, specifically with post-stroke depression. We actually get our community specifically evaluated in this research study, and they found that it helped, and it helped all by itself, and it helped when people also took antidepressants, medications to help them with depression. So what are the goals in this type of therapy? Therapy comes in all different shapes and sizes. You can have supportive therapy, you can have cognitive behavioral therapy, you can have dialectical behavioral therapy. Therapists often have kind of a theoretical orientation, and it's kind of like their map as they go through treatment with someone. A lot of us we consider ourselves kind of eclectic. I would probably say I'm mostly eclectic, but I do have to say I love like analytic and dynamic therapy. And the idea with an eclectic therapist is they pull from their toolbox what you need in that given moment. So you could have a long-standing issue with your mom, or you could have a bona fide beef with the way your husband speaks to you now that you have a little bit of, you know, aphasia. So it really depends on what the issue is. So in CBT, in cognitive behavioral therapy, what they really focus on is the C, the cognitive, how you think. They want your healthy coping skills to be as healthy as possible. They want to guide you to doing things that will improve your mood and your functioning, okay? They want to help you when you have a big emotion that overwhelms you, anxiety, grief, sadness, hopelessness. They want you to be able to process it with the best possible self-talk, and then to go and do something that will actually make you feel better as opposed to make you feel worse, right? There's such a, almost like a magnetic pull to unhealthy coping when we feel down, right? The overeating, the getting back in bed, the self-isolating, the, disaster thinking, the, thinking all of a sudden we've developed psychic abilities and we know what the future holds, right? This CBT really helps keep you in check with making sure your thoughts aren't actually becoming a part of the problem, okay? And one of the other things I want you to think about is maybe a medicine, maybe an antidepressant, okay? Because in the last 10 years, there's been some really good research studies about how antidepressants work. And so the most research has been done on Prozac, nortriptyline, and Lexapro. And the way we used to think that antidepressants help, specifically what we call SSRIs, selective serotonin reuptake inhibitors, is that they add a chemical called serotonin into the brain. And more serotonin means more happiness. Well, what we figured out through stroke studies, how cool is this, is that medications, specifically Prozac, also help by promoting the growth of new neurons in the brain. So they've done studies with people who were depressed and weren't depressed and had trouble using an arm in acute rehabs, right? And they gave them all Prozac, and they had another group that had paralysis in the arm, not depressed, didn't take any medication. So they got 3 groups, right? And they decided to measure not only people's mood after they took the Prozac for a few weeks, but also how much function of their hand they got back. And people who took the Prozac, depressed or not, got more function of their hand back, especially when it was combined with intense physical therapy. And that's a theme, if you've been paying attention, that I say a lot, which is a lot of my best strategies for you, best recommendations, happen in combination with traditional therapy, okay? So it's not to say you want to go rogue and try to do all sorts of new things on yourself, but take what they give you in traditional rehab and then learn and educate yourself to be able to add something else on that might be a little bit, not on the typical rehab path, but that can boost your rehab up, right? So this is something that I always call on these studies when I have a patient in my office who is bona fide depressed, but doesn't want to take an antidepressant, doesn't want to be a person who takes an antidepressant, doesn't want other people to know they're taking an antidepressant. And I help them understand these research studies. And now all of a sudden, instead of it just being a mood issue and we as a person might find relief in an antidepressant, now all of a sudden, oh, it might help my hand. So people, especially men for some reason, seem to really value that information, okay? So some of us believe that the early use of antidepressants after a stroke might really improve rehab and recovery regardless of the presence or absence of depression. So that's something we've kind of talked about before too. If we fast forward 10, 20 years down the road in stroke care, man, I have high hopes for how we can become more progressive. And so we've talked a little bit about the support of CPAP very soon after, the support of antidepressants, more support for our caregivers, more training for caregivers to know what they're actually supposed to do, a lot more psychological support, and of course, much longer and more intensive therapies. Once you kind of go through your own emotional journey, and you feel like you've had a period of emotional stability and you feel like you've really processed what you've been through. Remember I said before, the emotional journey is different for everyone, but there are some pretty universal stages. And the first is always the security and predictability, safety phase. And the last is always the giving back phase. And this can be in a variety of ways. It doesn't mean you have to dedicate your life as a volunteer for the American Stroke Association, okay? I just want you to find a way to use your experience, your journey, with this stroke to benefit other people. So let's just think about that for a second. This can take many different forms depending on what you're interested in and what you can do. So COVID aside, visiting people in local rehabs who've had a stroke, I can't really even tell you how valuable that is. When I was up at the University of North Carolina in Chapel Hill, acute stroke rehab center, I was one of 2 neuropsychologists that worked up in the stroke unit. There were a handful of people that I'm still in touch with to this day. I still go out and support their missions and their walks and their support groups that they lead in the community. And, you know, once a week, they would go to the unit and ask the head nurse, you know, hey, who do you think could use a friendly visit today? And man, those visits did so much more than I could ever do as a psychologist, because people want to see someone else who's ahead of them in the journey, right? They want to see what is my life going to look like, you know, in 6 months, in 5 years, in 20 years. They want to hear about what to expect. One of the scariest things about a trauma is how it creates a heightened sensitivity to unpredictability. We so desperately as human beings want to know what to expect. And when we can't answer that question, it's very traumatic for a lot of us. Speaking at a local senior center, they can always use speakers. Put together a little PowerPoint on stroke prevention. You know, what do you wish you would have done different, maybe, if you had some risk factors that weren't properly controlled. This is my favorite one. I try to do this as much as I can. Advocate for more progressive stroke care. You know, write your governor a letter. Write the president of your hospital. Write your neurologist, and, you know, tell them how your needs are being met when they do a good job, and how your needs are not being met when you don't feel like the system is rising to the occasion and giving you their best so you can have your best. Even if it's at the level of just inviting other people to email you. You know, you might hear a friend of a friend, wow, you know, my cousin just had a stroke, my sister's teacher, my teacher's kids, you know, whatever, somebody had a stroke. You know, hey, here's my email, let them call me, you know, caregiver or person. Those kind of things really, really matter. Remember, I said it's just if one person shows us the way, validates us, shows us the path, it can make all the difference in the world. So you don't have to be ready to do this right now. You might just have the idea. You can start to think about the plan. You know, how is it that you would actually try to do this in real life? But when you're ready, and I know someday you will be ready, when you can take that action, that will be a sign to yourself that you have really worked hard on your own healing. And I know that that will be an important part of your journey for sure. So, you know, I want to close with just a couple other thoughts. Being emotionally strong doesn't mean that you don't cry, okay? And I want to try to convince you of this by telling you a little bit more about tears. It's really interesting. Emotional tears contain stress hormones, okay? If you look at different types of tears under a microscope, so believe it or not, we have different types of tears. We have tears we cry when we're grieving, when we're mad. Do you ever get so mad you cry? When we're sad, when we're hurt, you know, when we're feeling sensitive and we feel, you know, insulted, or, you know, we have happy tears, we have laughing tears. They literally look different. They're different shapes. You can Google that. It's really cool. An artist, I want to say in Maine, did an art show with different types of tears. It's really cool. And and the reason they're different shapes is because there's different chemicals in them. So when we cry, like a good cry, not just like a little like, but we're talking like the full ugly cry, this releases endorphins like oxytocin. And if you pay attention to actually how you feel after a good cry, you do feel relieved. You do feel a sense of well-being. And it's because we've changed our brain chemistry, okay? So if you hold in the tears and you don't let them flow when they want to flow, you're not giving yourself an opportunity to release and have that recovery phase. Crying also activates a part of our nervous system called the PNS, the parasympathetic nervous system. And this is what kicks in after a stressor that helps our body to kind of reset, rest, and recover. So crying is one way that you almost can like boot the system. It's like turning off your computer, pushing that start button again and getting the whole system to re-up. Of course, we don't want you crying and crying and crying and crying. Some people don't cry because they feel like if I start, I'm never going to stop. Sometimes our emotions can become very unregulated after a stroke, and we can have pseudobulbar palsy, pseudobulbar affect, where we can go from laughing to crying to overly crying. Believe it or not, I don't see that symptom that common in my clinical practice. And in fact, I started to see about 2 years ago people coming in wondering if they had it more and more because a drug came out and there was a pretty good marketing campaign. And I found that local neurologists were actually giving samples of the medication. So to be truthful, I sometimes wonder if that symptom has been amped up a little bit by the industry. Of course it exists, it's a real thing, but I just can tell you from my experience of seeing hundreds, if not thousands of people with stroke, that it's very, very, very rare. But if that happens to you, there are medications that can help. But, you know, as a psychologist, my first pass would always be to try to understand the grief and maybe what's underneath the behavior. So a lot of this talk about emotional recovery brings up the question of identity. And I want you to just think about that over this next week. You know, which one of these do you identify as being now? And which one of these do you want to be in the future? You know, we can be a stroke victim, we can be a stroke survivor, and we can be a stroke thriver. And I am here to tell you in this rule today that I really believe that it's the emotional part of your recovery that can push you from survivor to thriver. So please don't not take the messages of today serious. I really want you to think about them. And it ultimately comes down to what you're going to choose, right? If you want to really try to get back in touch with a sense of emotional strength, or maybe that's not the time for you right now, but you're going to keep my message in mind as you move forward in your recovery. So let's end today with our self-empowerment statement. I want you to say this with me. I will make my emotional recovery a priority. I commit to more positive coping starting today, starting right now. And we're going to do our Q&A in a second, but I want to remind you, we'll be back together next Thursday for rule number 7. This is supporting those who support you. This is for caregivers. This is about caregivers. If you have a support person, I want you to get their experience. I want you to be a good care partner back to them for being a good care partner to you. So that's October 29th at 4. If you haven't signed up yet, you can go to the website listed here and get yourself a spot. So now we're going to switch over to our awesome question and answer session. This is where Dr. Sullivan has to learn how to use her computer again. Oh, it's so funny. But hey, look guys, we made it through. Go back up here. We made it through with no bugs. I didn't have any bugs. I didn't have a praying mantis. I didn't have a, here we go, cool. I didn't have a wasp. I didn't have a bee. You know, that's pretty impressive. So I think Jerry, let me see. Jerry, I think, is usually my good Q&A guy. He is out having a wedding anniversary dinner with his lovely bride. So let's all wish Jerry and his wife Barb a very happy anniversary. Jerry is a wonderful supporter of me and my brain health mission of education and empowerment. He is a excellent advocate. He's really working on that emotional journey and gives back quite a bit on his Facebook page. And we are a big fan of you, Jerry. So, all right, let's see here. Do we have any questions? Hopefully that means y'all are thinking and wondering how you're gonna put all of this information into practice. All right. So let me go through and let's see who's here with us today. Oh, this is nice. I get to see your guys' names now. Oh, nice. I had the pleasure of going on Joanne and Brad's podcast this week. I wanted to tell you all about that, and I want to actually tell you about it so you can watch it if you're interested. It's called the Don't Count Me Out podcast, and this is by stroke survivor Joanne Glim and her partner Brad. He had a different type of a brain health challenge. He had an abscess in his brain, and they hosted me so kindly and were incredibly interested in stroke recovery, and we had a very, very nice conversation. And I hope that you guys will watch the podcast. I'll actually ask Carrie to send a link to it when she does the email send out with the rebroadcast and the handouts either tonight or tomorrow morning, so that you guys can all get a link to it. Okay, so I hope that you can hear me. All right, there we go. See the Q&A button there? If anybody wants to type in a question, I would be more than happy to entertain it. Okay, well, I want you all to have a great week. I want you to consider what I said seriously, and I want us to join again here together next Thursday night. It was very nice to spend this time with you. I was looking forward to it all week, and I will be very excited to talk with you next time all about caregivers. Okay, you guys, take care, and I'll see you next time. Bye-bye.